one of the first things that I did, I don't think I even realized that it was me advocating for myself, but one of the first things I did was I started creating a list of clinical trials that I might qualify for if I were to have progression. This is actually pretty early on in my diagnosis. It's around 2017. I had been living with metastatic disease for 2 years. And I was just getting nervous and antsy that the stability wasn't going to last, that I should really make sure that I know what I'm doing if I were to, if I were to have progression. So I first started by looking at just HER2 positive clinical trials. Then I learned about how your subtype can actually change. And I thought, well, maybe I should look at ER positive and triple negative. And so I started this list, which ended up becoming a database. And from that, I decided, let's just make it a website. Maybe this will help other people. Maybe other people would be interested in like, these trials that I'm finding. And so I created a website called thestormwriters.org. Stormwriters is a nod to my father, who I lost from a rare type of cancer. He loved the Doors, and Riders on the Storm was one of his favorite songs. And it kind of felt like that as a breast cancer patient going through this metastatic disease and diagnosis. So created the database, actually attended the San Antonio Breast Cancer Symposium, and I wrote a big summary about the conference. I posted it on the website, and then I kind of just like put it out there. And it was wonderful because I got a really great response, and I had patients coming to me asking for help and feeling like they were at the end of their lines of treatment. What should they do? And so I started compiling, even making a bigger list. So I was looking not just at trials that were for breast cancer, but advanced solid tumor trials. And I was actually looking at brain metastasis trials and liver metastasis and things like that. And as I was doing this and like compiling all this information, I often would include the exclusions so that when a patient is looking, they can just very quickly see what is excluded. And it was like every single trial excluded brain mets patients. I can literally quote the wording because it was so common. It was clearly like a cut and paste that they would use from previous protocols. So that really, was concerning that there were so many patients, there were so many trials excluding patients with brain mets, and definitely trials excluding patients with leptomeningeal disease. So part of this website, which I'm really excited about, is we now have an option for searching for clinical trials for patients with brain mets. And you can even sort it by whether you have stable brain mets or active brain mets. And it's a collaboration with breastcancertrials.org. Very reputable organization. I've been consulting with them for years now to make sure that they have all the trials for which a breast cancer patient may qualify. And they were very excited to take on this collaboration and project to make sure that we're bringing trials. We're making it easy. We're taking the burden off of the patients and making it really easy for you to find trials. And you can even sort by like treatment type and intervention. So chemotherapy, no chemotherapy, radiation, things like that. So there's going to be a lot of different options. And I think it's the first of its kind. There's nothing like this that exists. Let alone just a brain mets website in general, but this one actually has trials that you'll be able to filter and search for yourself. So I think it's going to be an amazing tool for patients.